Back, with the amount of people who have passed away and the growing number of people infected, many of us really looking now to some solutions such as medicine that can help us out here, ease our minds. However, there is still no proven cure or treatment. Joining us via FaceTime to sort this all out, fact versus fiction, is Dr. Sonali Lal. So good morning to you, and thank you so much for joining us this morning. I want to get right to what the president talked about yesterday during his press conference. He talked a lot about hydroxychloroquine and these Z-Packs. He's saying he's stockpiling them. But there seemed to be a bit of discord with Dr. Fauci on this one. So what is your take and what are you hearing about this?
So, right now, we all need to just understand that there is no miracle cure out there. There's no one drug. And, the president has spoken about hydroxychloroquine. 4,000 New Yorkers have been treated with it, and he is stockpiling it. It's a drug that's been around for decades, used as an anti-malarial. A lot of other countries are using it as frontline treatment for their healthcare workers as a prophylaxis. The main thing is that there's only small anecdotal studies, some based out of China, some out of France. There's not enough evidence to say that this is the answer. It is, right now we're in a do or die situation, so we're going to take what we can get. So, it is promising, it is good to have, but it is not the cure.
But some people are worried about side effects if they do this, right, without knowing. What do you know about taking them combined?
So my biggest concern is, the tweet that was given out about with a combination of hydroxychloroquine and azithromycin. Now, that's not something to be taken lightly. That's not something you call your doctor and say, hey, can you prescribe this for me? It is a combination of those medications can actually affect your heart, cause heart arrhythmias, and they can be fatal. So it's not something that you want to combine or take together unless you're being supervised by a doctor.
So also, a lot of people are with their family members are in the ICU. They're looking for any bit of hope, and they're throwing anything at the kitchen sink to try to treat their family members. We're hearing things like remdesivir and other virals like the HIV medication Truvada also helping. What are you hearing about this on the front lines?
So remdesivir has shown promise. They're in a phase 3 trial. It's really being used for the critically ill right now. It's for compassionate use. There's a lot of conflicting information on that, but it has shown promise. But once again, it's not something that you just keep in your cabinet. It's something that's used in the ICU or in the hospital. And there's a lot more studies that need to be done before this becomes mainstream.
So yesterday, I popped into my local drugstore, Walgreens here in Manhattan, and I noticed that there were a whole lot of pills missing from the vitamin area right now. So wellness is a big part of this. Things like zinc, vitamin C, vitamin E, elderberry, they were all missing, sold out right now. So do those things actually help boost your immune system and protect you from getting the virus?
Well, right now we've been given this probably this month at least to get strong and really boost our immune system. So yes, absolutely. Vitamin C, we're all reading about how vitamin C, high dose vitamin C IV is being given to even patients with corona in the hospital. So this is our time to become strong. You want to start taking at least vitamin C. We want to put that in our cabinets. We want to take at least 1,000 to 3,000 milligrams daily. You want to take it on an empty stomach, and you want to, and then you want to snack. You want to snack on healthy vitamin C rich oranges, pineapples, lemons, whatever you can get your hands on. Vitamin C has been shown to decrease the incidence of pneumonia and help make your white blood cells stronger so they can fight the infections. Along with that,
I want to be clear here because we
I'm sorry.
I just want to get real quick on the vitamin C because we heard a lot about that has to be IV input, right? But you're saying you can take it pill form. Do things like Emergency, that little packet of powder you can put in your water, it says it's 1,000 milligrams. Does that help boost your system here? Or is it psychosomatic?
No, absolutely. I use that for my own family. We take a sachet in the morning and one in the evening it absolutely is a perfect line of treatment right now. It does not have to be IV.
Understood. Okay. And then also you were mentioning vitamin D, right? Vitamin D, zinc, elderberry. What are you thinking about those things? Is all of this just a way to really help boost our immune system? We're home, right? We're getting a lot of sleep. So hopefully that's helping us.
Absolutely. So yeah, vitamin D actually acts as a barrier, and it's actually shown with rhinovirus to act and helps prevent the helps prevent the virus from entering the cell. Vitamin D is also it's fat soluble, so you want to make sure that when you're taking it with food. You ideally want to take vitamin D with vitamin K, 5,000 international units daily, ideally with breakfast and lunch. You know, and we're in the Northeast. We're all vitamin D deficient. So this isn't like, should I take it?
Yeah.
This is, you need to take it.
We're not getting outside either to get the sunlight that we need, right? Also, last question. We only have about 10 seconds left. Taking allergy medicines with any of this right now, because there's a lot of allergy sufferers, is that going to hurt you at all, or what do you know about that?
Yeah, no, that should not affect anything. So if you are having allergies, you can go ahead and take that. There's nothing, should be no contradiction with that. I just want all of us to just get some
Got it.
sleep, meditate, ditch that dairy, increase your probiotics, and, take lots of fiber and get some zinc in.
There you go. And you know what? I'm drinking my vitamin C right here. I got
Great.
my emergency in a cup. It looks lime green here, but it's got some zinc in it as well. Hey, thank you for helping us. I think there was a lot of good information that really people can understand to help boost their immune system. So I appreciate your time this morning, doctor, and stay safe to you, okay?
Thank you.